For today's afternoon, guys, we will be tackling the National Tuberculosis Program. So, National Tuberculosis Program is one program of the Department of Health that is considered protocol-based. Meaning, kapag may pumunta sa health center na may signs and symptoms ng tuberculosis, you don't need to refer this to the physician or the medical officer. You as a nurse or as a midwife, you simply need to follow the protocol na meron tayo for National Tuberculosis Program. And we can assess the patient and send the patient to a proper diagnostic test if possible. At pag bumalik siya and the case of the patient turned out to be positive or confirmed tuberculosis, meron natin kakayahan na mag-dispense the medications that are available in the community itself. And these are all given free of charge under the National Tuberculosis Program. As I've mentioned, your National Tuberculosis Program is a program in the Department of Health that falls under the international concept of your DOTS. What is DOTS again? Direct, Observe, Treatment, Short-Term Course. Meaning, this is actually from the word itself, observatory treatment. Okay, babantayan natin yung pagtitik ng gamot ng ating pasyente. Now, in the Philippine setting, guys, when we talk about tuberculosis, let's talk about tuberculosis na muna. Okay, sumagot. What is tuberculosis? Pag sinabi natin tuberculosis, this is caused by what? Bacteria or virus? Bacteria. What is the causative agent? Mycobacterium tuberculosis. Pag sinabi natin tuberculosis, pwede ba yung pulmonary? Yes. Pwede ba yung cutaneous or integumentary? Yes. Pwede rin ba yung tuberculosis of the bone? Yes, especially your spine, yung Pott's disease. Nakakaintindihan? So these are all caused by your Mycobacterium tuberculosis. When I talk about Mycobacterium tuberculosis, guys, the causative agent is bacteria, and it is manifested by 2 weeks of non-stop or continuous coughing. Okay? Inuubo siya ng more than 2 weeks. Meron siyang night sweats and late afternoon fever. And yung late afternoon fever niya is low grade. Tapos bigla siyang mangangayaya. Okay? Bigla siyang mangangayaya. That is your tuberculosis. Now, tuberculosis can be tested or confirmed through several or through diagnostic tests. And all these diagnostic tests is given free of charge at the level of primary healthcare. Okay? Or level 1 primary healthcare facility. So let's talk about the diagnostic test. Kapag sinabi natin confirmatory test, the confirmatory test is still your sputum exam or your DSSM, direct sputum exam, direct smear sputum exam microscopy. Yan. DSSM, your direct smear sputum microscopy. That is still the confirmatory test. Okay? If in case naman that the patient does not have any productive cough, pwede naman tayo magkaroon ng another test, which is your X-ray. Okay, X-ray. X-ray is to look for any lesions available in your lungs, for any infiltrates. Okay, makikita ito sa interpretations, of course, ng mga radiologists natin. Then after that, sa mga bata, commonly, ginagamit natin is your PPD. What is PPD? Purified Protein Derivative Test, or your Mantoux test. Mantoux test or Mantoux test. M-A-N-T-O-U-X. Mantoux test. Mantoux. Kunada. So Mantoux test or your screening test for tuberculosis. So Mantoux test is your screening test for tuberculosis. Mantoux test or your PPD test is the screening test for tuberculosis. Paano ginagawa nito? We are going to get the medication, then we're going to create a bleb. Ano bleb? Wheel. Okay, dito sa inner forearm ng ating pasyente. Then we're going to left that for 48 to 72 hours. Okay, so bibilawan natin yan, then we're going to measure the duration, and then we're going to measure the diameter. Okay, the diameter. So diameter interpretations natin is different. Okay, pag 5 mm, for example, yung less than 1 mm lang kasi yung laki nung iigawin mong bleb. So less than 1 mm or at least 1 mm yung bleb na gagawin mo, then after 48 to 72 hours, i-reassess mo yan. Pag umabot siya ng 5 mm, for a normal person, okay, normal po yon. Okay lang yon. Okay? Pero for a person that is immunocompromised, that is already considered as a positive Mantoux test. Okay? For those who were exposed naman, example, like us, the health practitioners, it would take at least 10 mm for us to become positive for Mantoux test. Okay, 10 mm. And 15 millimeter naman po pag layman's. Ibig sabihin yung walang exposure. Okay, for example, nandiyan lang naman sa paligid, nagtitinda, pero ba't hindi siya nagkaroon ng sintomas ng tuberculosis? Kapag mag-screen tayo sa kanya, ginawa ang mantle test, we need at least 15 mm na lapad ng diameter ng blood para ma-confirm natin. And we will subject the patient for confirmatory test, which is TSSM, especially if the patient or if the person is having cough for more than 2 weeks. Are we clear so far? Maliwanag po tayo? So again, ano yung mga signs and symptoms? Meron ba tayong cough for more than 2 weeks? Yes. Meron ba tayong late afternoon afternoon and low-grade fever? Yes. Sudden loss of weight? Yes. Lahat po yan. Ay, signs and symptoms ng ating pasyente na may tuberculosis. Ano yung mga diagnostic test natin? Ano yung confirmatory? Direct sputum, smear microscopy. Ano po yung ating secondary? X-ray. Pwede ba yung pang PPD? Yes, pag sinabi natin PPD, screening test ba ito? And commonly sa practice, meron tayo tinatawag na gene expert. Okay, gene expert para din siyang BSSM, it will provide you a more detailed comparison in terms of the microscopy of the patient. Gene expert, G-E-N-E, expert, E-X-P-E-R-T. Okay, common na ginagawa na yan, lalo sa mga senior citizen. Are we clear so far? Are we clear so far? Yes, in terms of management of your tuberculosis, your management of tuberculosis will undergo, or your tuberculosis will undergo the management of multi-drug therapy. Pag sinabi natin multi-drug therapy, ibig sabihin, we will be using multi-drug approach. Maraming types ng antibiotics ang ating gagamitin. Why? Because there are proven things that there are certain strains of Bacillus family and Mycobacterium tuberculosis strains that are resistant to a specific antibiotic. Kaya gumagamit tayo ng several types of antibiotic to address the problem. And when we talk about antibiotics in terms of treatment of tuberculosis, meron tayo natatangi, 5. Ano yung 5? Rives po ba ang ating mnemonics? Yes. What is R? I. Pyrazinamide. E. Ethambutol. S. Streptomycin. Pag sinabing R, at pag sinabing rights, hindi lang dapat tayo aware sa gamot, kailangan aware din tayo kung paano sila binibigay. Nagkakaintindihan? Pag sinabing binibigay, lahat po sila oral except streptomycin. Lahat po sila oral streptomycin. Okay? Except streptomycin. Oral po sila except streptomycin. Ano po ang route ni streptomycin? IM. Deep IM po siya. Deep IM. And pag nagbibigay tayo ng gamot, should we be aware of the side effects? Yes. Anong side effects ng ating rifampicin? Red-orange secretions. How about your isoniazid? Itchiness. Kapag nangangati ang pasyente, ano pwede natin bigay? Vitamin B? Anong vitamin B complex? Specific vitamin B6. Anong vitamin B6? Pyridoxine. And pyrazinamide. Side effect? Increased uric acid. So pwede magkaroon ng gout. Yes, kung possible na magkaroon ng gout because of increased formation of uric acid crystals sa ating greater big toe. Ano dapat ang i-advise natin sa pasyente? Increase fluid intake. Kailangan ba iwasan din ang mga pagkain na mataas sa uric acid? Bibigyan mo ba ng mani? Maning basa? Tuyo? Maning madulas? May 3 types ng mani, am I right? Ano yung maning basa? Nilagang mani. Very good. Ano yung maning tuyo? Sinangag. Maning madulas. Prito. Did you get it? 3 types. Ano ba ang iniisip nyo kasing mani? Masarap ba ang mani? Yes, of course. Lalo pag gabi. Habang nanonood ng TV. Did you get it? Ang babastos nyo. Mga batang ito. O sige, para sino naman. So, iwasan mo ba ang ibang mataas na uric acid? Yung mga bean product ba, iwasan mo? Pwede ka bang kumain ng munggo? No. White beans? Black beans? Brown beans? Magic beans? Walang ganon. Dragon Ball Z yun. Nagkakaintindihan? O ano pa? Iwasan mo rin ang mga red meats. Tama? Ano yung mga sample ng red meats? Kasama dyan ang manok. Ano? Nakita ka na bang manok na pula ang karne? Wala pa nun. So pag sinabi natin red meat, ano yung mga yun? Andyan ba si beef? Yes. Ano pa? Sheep. Ay, sheep. Lamb. Ganon. Wala kayong ganon? Dinosaur. Walang ganon. Of course, iwasan mga red meats. Ano pa? Organ meats. Pwede ba? No. Bawal ang organ meats. So, pwede bang pinapaitan? Sisig. Bopis. Bawal yung mga yun. Kasi mataas sa uric acid. Nakakaintindihan? Yes. E. Ethambutol. Anong expectations niya? Mata. Tama? Yes. Okay. Expectations niya ay mata. And streptomycin. Streptomycin. Ano siya? Auto, toxic, and nephrotoxic. Lahat ba sila toxic sa atay? Yes. Kaya dapat ang advice natin sa kanila is increase fluid intake. Nagkakaintindihan? Nakakaintindihan po ba? Yes, dapat alam natin yan at dapat sabihin natin sa mga pasyente para hindi sila mabigla pag nag-take sila ng gamot. Review lang po ito, makinig na maigi. Now, before we manage the condition of the patient at magbigay tayo ng mga gamot, the first thing that we need to do under your National Tuberculosis Program is to identify what category yung ating pasyente. Okay? In terms of categorization, ilang categories of treatment meron tayo sa tuberculosis? 4. O, sulat mo dyan. Category 1, 2, 3, 4. Category 1, 2, 3, 4. 1, 2, 3, 4. Pag-usapan natin, ano ang mga category 1? Category 1 siya. Category 1 kapag first time tuberculosis. First time TB. So pag first time niya nagka-TB, category 1 yan. Category 1. Okay, first time nagka-TB, category 1. At kailangan pag first time niya, positive. Positive ang DSSM. Positive ang DSSM. Ano ulit ang DSSM? Direct sputum-ear microscopy. Okay? Positive dapat ang DSSM. Sir, negative ang DSSM niya kasi hindi naman siya inubo. Pero yung kanyang x-ray, merong extensive lesions. Category 1 pa rin ba yun? Yes. Extensive lesion with negative DSSM is still category 1. Ulitin ko po. Ano na yung dalawa? Kapag positive ba ang DSSM, category 1? Yes. E paano pag negative pero may extensive lesion upon x-ray? Category 1 pa rin ba? Yes. Sino pa? Immunocompromised. So ito ba yung may mababa ang kanilang immune system? Yes. Sino pa? Children. O yung tinatawag natin, primary complex. Tuberculosis in children or your primary complex. Tuberculosis in children or your primary complex. Are we clear so far? Yes. That is your category 1. Category 2. By the way, pag immunocompromised, kasama na rin po dyan si HIV. Nagkakaintindihan? Yes, kaya nga pag ikaw is positive for HIV or positive for TB, either i-check. Pag ikaw positive ka ng HIV, i-check ka for tuberculosis. Pag positive ka ng tuberculosis, i-check ka rin for HIV. Okay, part po yun ng protocol na sinusundan natin. Okay, let's start with category 2. Pag sinabi natin category 2, meron siya dati hindi nag-take ng gamot or nag-take ng gamot, tas bumalik ulit. O basta nagkaroon na siya dati. Sino itong mga to? Defaulters. Okay? Defaulters. Ano pa? Incomplete treatment. Defaulters. Incomplete treatment. Ano pa? Defaulters. Incomplete treatment. Ano pa? Returnee. Lahat ng possible term. Basta siya ay nag-treat na before, tapos hindi niya kinumpleto yung gamot, tapos bumalik ulit siya, meron ulit siya. Category 2 yun. Nakakaintindihan? Cat 2. Okay, Cat 2 po yun. Okay, Category 3. Negative DSSM with minimal lesions upon X-ray. Negative DSSM with ano ulit yun? With minimal parenchymal lesions upon X-ray. Sino na ulit yung may extensive? Category 1. Sino yung may minimal? Category 3. Okay? And category 4 is chronic. Meaning the patient is having tuberculosis, nag-treatment naman siya pero hindi gumagaling. So ano ang condition niya? Chronic. Okay, 6 months na siyang nagtitreat ng tuberculosis. Hindi pa rin maalis-alis yung tuberculosis sa sistema niya. Kailangan na po natin siyang i-category 4. Category 4. Kasi ibig sabihin ng category 4 is referral. Referral. Category 4 is referral. Nagkakaintindihan? Okay, sabihin mo sa akin kung cut 1, cut 2, cut 3, cut 4. Cut 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Referral. Extensive lesions. Minimal lesions. Positive DSSM. Immunocompromised. Defaulter. Meron siya dati, tapos bumalik ulit. How about your primary complex? Primary complex? 1. Extensive lesion. Immunocompromised. Negative DSSM with minimal lesions. Minimal lesions? Referral. Are we clear? So after na makategorize natin sila, pwede na tayong mag-manage ng kanilang condition. As I mentioned earlier, kapag sinabi natin treatment of your tuberculosis, it is multi-drug therapy. Multi-drug therapy at long course po ito, mahaba-haba ang gamutan. Okay, minimum of 6 months. Minimum of 6 months. Minimum of 6 months po ang ating gamutan. Okay? Para mabilis natin tandaan ang inyong treatment, category 1, 2, 3, 4. Inabas sa bibig, ano ulit? 1, 2, 3, 4. Saba? Mas malakas. 1, 2, 3, 4. Pinakamalakas. 1, 2, 3, 4. Category 4, refer. Ibig sabihin, pag ang category niya is 4, refer agad. Wala nang usap-usap. I-refer na agad yan. Kung chronic na yung kanyang condition, hinang-hina na, naggamot na, pero may tuberculosis pa rin, we need to refer this to the hospital. Okay? Specifically to yung pulmonologist. Nagkakaintindihan? Yes, ulitin natin. Ilang categories meron tayo? 1, 2, 3, 4. Saba? 1, 2, 3, 4. Category 4? Pag pinag-uusapan natin ang treatment, guys, dalawang course po yan. Meron tayong intensive, ibig sabihin, masinsinan, and continuation. Continuation. Ilabas sa bibig. Ano yung dalawang phase natin? Intensive and continuation phase. Intensive and continuation phase. Intensive and continuation phase. Category 1, 2, 3, 1, 2, 3, 1, 2, 3, 4. 1, 2, 3, 4. Ano ulit ang category 4? Refer. 1, 2, 3, 1, 2, 3. Pag-usapan natin ang buwan. Ilang buwan ang gamutan? Sulat mo dyan. 2, 2, 1, 2, 4, 5, 4. Sulat mo dyan. 2, 2, 1, 2, 4, 5, 4. Labas sa bibig, ilang category meron tayo? 4. Category 1, 2, 3, 4. Saan ba? 1, 2, 3. Mas malakas? 1, 2, 3. Ilang buwan ang gamutan? 2, 4, 5, 4. Category 4? Refer. Are we clear? O, ilitin natin. Labas sa bibig, ilang categories meron tayo? I-memorize. Walang ibang panahon kung kailangan i-memorize ito ngayon. I-memorize ngayon na. Did you get it? Yes. Category 1, 2, 3, 4. 1, 2, 3, 4. Ilang categories ulit meron tayo? 4. Category 1, 2, 3, 4. Category 1, 2, 3, 4. Category 4, anong gagawin? Refer. Category 1, 2, 3, 1, 2, 3. Bigyan mo sa akin ang 1. 2, 4, 5. Saba? 2, 1, 2, 4, 5. Mas mabilis. Saba? 2, 2, 1, 2, 4, 5, 4. 2, 2, 1, 2, 4, 5, 4. Category 4? Ilang buwan ulit ang gamutan ng category 1? Intensive phase. 2. Kapag sinabi natin category 1, category 2, intensive phase, dalawa. 2 and 1. May explain natin kung bakit 2 and 1. Nakakaintindihan? Yes. And category 3, ilang buwan? 2. Referral. Sabi sa akin, 1, 2, 3, 4, 5, 4. Isa ba? 4, 5, 4. Are we clear? Ulitin natin. Category 1, 2, 3, 4, 1, 2, 3, 4. Category 4? Refer. Ibang sa bibig, nakasan. Category 1, 2, 3, 4, 1, 2, 3, 4. Category 4? Refer. 1, 2, 3, 1, 2, 3. Give me the man. 2, 1, 2, 4, 5. Saba? 2, 2, 1, 2, 4, 5, 4. Saba? 2, 2, 1, 2, 4, 5, 4. Category 4? Did you get it? Yes. O, sunod natin. Ano yung mga buwan na yan, sir? Ibig sabihin, gagamutin natin sila ng multi-drug therapy ng ilang buwang gamutan. Ng anong mga gamot? Anong mga gamot niya mga yan? Isulat natin. Alright. Ano ibig sabihin ng ripe? Hinog. Did you get it? Sulat mo dyan. Nasulat mo na, burahin mo ulit. Gutom ka na naman, kakain mo lang. Ripe. Ripes. O, ibig sabihin naman ng ripes, mga hinog. Did you get it? Plural ba? Ripe. 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 Re. You read this as re. O, ulitin. Ano basa dito? Re. Ripe. Basahin ulit. Anong basa dito? So, paano natin babasahin? Ripe. Ripes. Ripe. Ripe. Re. Ripe. Re. Saba? Ripes. Ripe. Ripe. Re. Ripe. Re. Isa ba? Ripe. Ripes. Ripe. Ripe. Re. Ripe. Re. Mas mabilis. Anong ripes lahat? At kainog lahat? Isa lang ang may S, yung pangalawa, ulitin. Ripe. Ripes. Ripe. Ripe. Re. Ripe. Re. Isa ba? Ripe. Ripes. Ripe. Ripe. Re. Ripe. Re. Mas mabilis. Re. Re. Bigyan sa akin ng 1, 2. 1, 2. Isa ba? 2, 2, 1, 2. Category 4. Bigyan sa akin ng 1. 2, 1, 2, 4, 5. Anong gamot? Re, isa ba? Re. Ano ibig sabihin yan? Pag sinabing category 1, you have to manage it intensive phase, 2 months of ripe. 2 months of ripe. Nakakaintindihan? 2 months of ripe. Walang streptomycin. 2 months of ripe lang. Okay? Then, 4 na buwan mo naman siya gagamutin ng continuation ng rifampicin plus isoniazid. Did you get it? Yes. So, 2 months ng ripe, then 4 months ng rifampicin plus isoniazid. A total of 6 months. Nakakaintindihan? So, ilang buwan siya nag-take ng rifampicin and isoniazid? 6 months. 6 months. Kasi 2 buwan dito, 2 buwan doon. Nagkakaintindihan? Yes. Ilang buwan siya nag-take ng ethambutol? 2 months. Ilang buwan siya nag-take ng paracetamide? Are we clear? Yes. Okay. Ganon din po dito. Pag sinabing intensive phase, 2 phase ang pinag-usapan natin for CAT2. Bakit? Si CAT2 po ba is matindi kasi nagkaroon siya ng resistance. Yes. Kasi nga naggamot na siya, hindi niya na kompleto, bumalik, may tuberculosis ulit. Kaya category 2 siya. Nakakaintindihan? Nakakaintindihan po ba? Yes. Kaya, 2 buwan mo siyang gagamutin ng rights. With S. Rights. Ibig sabihin, 2 buwang injection ng puwet yan. Araw-araw. Ay, gusto mo magtusok? Araw-araw. Araw-araw, tinutusok ang puwet ko. Ganon yun. Okay, so puntahan siya. And, 1 buwan ng right. Okay, wala na yung streptomycin. So, bali 3 buwan ang kanyang intensive phase, then 5 months ang kanyang continuation phase, but with ethambutol. Hindi lang rifampicin and isoniazid. Are we clear? And if you observe, category 3 is almost the same as category 1 in terms of management. Are we clear? Nakakaintindihan po ba? Are you sure? Are you sure? O, category 1, 2, 3, 4, 1, 2, 3, 4. Ilang categories ulit meron tayo sa TV? Category 4, management. Ano gagawin? Category 1, 2, 3, 1, 2, 3. Give me the man. 2, 2, 1, 2, 4, 5. Mabagal, bilisan. 2, 2, 1, 2, 4, 5. Mahina, lakasan. 2, 2, 1, 2, 4, 5, 4. Anong gamot? Saba? 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 Anong buwan? Saba? Category 4? Ano? Positive agent ng TB. What is the confirmatory test? Pag sinabi natin Mantoux test, PPD test ba yun? Pag sinabi natin X-ray, makikita ba ng lesions? Pag sinabi natin rights, ito ba yung rifampicin? Isoniazid? Pyrazinamide? Ethambutol? Streptomycin? Sa lahat ng gamot na yan, sino hindi oral? Streptomycin. Kapag sinabing lahat oral, lahat po ba yun? Si right po ba yun? Pag sinabing rifampicin, kailangan bang i-observe ang red-orange secretion? Itchiness po ba pag isoniazid? Increase uric acid pag your pyrazinamide. And ethambutol, pwede ba pang lalabo ng mata? Yes. Sino may ringing of the ear? Streptomycin. Pag sinabing streptomycin, pwede ba dyan ang ototoxin? Yes. Nephrotoxin. Lahat po ba sila sirasi atay? Kailangan po matasan ng tubig. Pag itchiness, isoniazid, bigyan mo ng vitamin B6. Pwede bang B-complex? Panas na mo ba yun? Yes. Pwede mo ba yun? Yes. Anong iiwasan pag pilagura ulit? Ang iwasan pag gouty arthritis, pwede ba ang beans? Beans. Munggo. Black beans. White beans. Magic beans. Beanstalk. Ay, mga ganun na. Nakakaintindihan po ba? Nakakaintindihan? Pag sinabi mo ba tayo mag-manto test, confirmatory test? No. Screening lang ba ito? Ano yung ating confirmatory test? DSSM. Nakakaintindihan? Ilang category ulit tayo? Lakasan? 4. Category? 1, 2, 3, 4. Category 4? 1, 2, 3. Give it naman. 2, 2, 1, 2, 4, 5. Sabang? 2, 2, 1, 2, 4, 5. Kung anong gamot? Right. Sabang? Right. Did you get it? Yes. Very good. Napakahusay nyo na. Papasal pa kayo sa board exam? Yes. Graduate po na sa July 14. Nakakaintindihan. Wag atat. Nakita kayo sa Baguio. Did you get it? Yes. Kasama siya sa Burnham. Sasakay kayo ng boat. Saka ko kayo ilalaglag. Masyado ka, sir. Nakakuha niyo mo ba? Oh, with that knowledge,